Dr. Quinn. And Dr. Quinn, we're talking about hair loss today. Sadly, it affects a lot of people. Sometimes it's your own doing, and most of the time it's not your own doing. Sometimes there's maybe some problems going on. So tell us, what is alopecia? What is hair loss? And is there anything you can do about it?
Yes, you can. You can have a conversation with your medical provider. Just 1 week ago today, I walked in a room, and the lady that was waiting for me, when I walked in, she did this. Her hair was so beautiful. It was flowing. I asked her, I said, do you want to do a TikTok video? And I got my phone out. I was ready. She said, no, Dr. Quinn. I just want to remind you who I am. She reminded me that she came a year ago, and basically her complaint was her hair was falling out. She was wearing a wig, asked a lot of questions. We did some tests, and we got a diagnosis. We referred her to a specialist, and they treated her. And basically, a year later, no more wigs, hair just flowing. And I told her that I'm so happy I was able to help her, but I wanted to share her story because there are a lot of people out there like her that are losing their hair. Maybe it's a diagnosis that can be diagnosed, it can be treated, and that person does not have to lose their hair. So have that conversation with your doctor. It could be many things like anemia, thyroid disorder. It can even be stress or anxiety, or like my patient, an autoimmune disorder that's very treatable. But have that conversation, and you don't have to lose your hair. It can come back and just be beautiful like that lady.
So what is alopecia then?
Alopecia is hair loss. It's just a general medical term for hair loss. It can be caused by many different problems, like I said earlier, anemia, hypothyroidism, autoimmune disorders, stress. My wife, she was very anemic early on in our marriage, the most happy 5 years of my life. We were able to diagnose her with anemia, and she was able to go see a hematologist. They put her on iron transfusions, and basically her hair is now back. It's so beautiful. So just talk to your doctor. Let them know what's going on. Let them do some tests, and you don't have to have hair loss. For a lot of people, there are some forms of hair loss that can't be treated, but at least give the medical providers a chance.
Dr. Quinn, thank you so much for talking about this. Before I let you go, though, our question of the day is, what is your biggest pet peeve? I guess you're a doctor, so you got to deal with a lot of things in life. Do you have any pet peeves?
I do. Do not kick the can down the road. Anything that you can handle, handle it. My wife and I, we were talking this morning. Her oil light came on. I took her car to the dealership this morning. She said, don't worry about it. I said, let's handle things right away. Let's take care of whatever needs to be handled.